thank you guys for joining us from another Health Truth Life video here, and happy Blue Monday to everyone out there.
Gosh, I'm feeling kind of sad, or
Yeah, you
a
know,
little bit,
a little gloomy, a little down, a little blue.
little blue, baby.
Yeah.
You know what? I mean, I say that I'm not laughing at it at all. I wouldn't laugh at anyone being blue or depressed.
Yeah.
But I certainly, even the past few weeks, have been kind of a little bit lower energy, and so these are things.
Yeah, it ties into the SADS, the seasonal effectiveness disorder, and I honestly didn't even know there was a Blue Monday until recently.
Yeah.
And it basically is, advertised as the gloomiest, saddest, most depressing day of the year.
Right.
What I read about it was it's, shortly after Christmas, your vacation time's over, kind of getting back to the grind, shorter days. So you've got more darkness, less light.
Absolutely.
What else was it like?
That's one of the biggest things. But then also, if you think about your activities from the holidays, the adrenaline you have running through you for Thanksgiving, Christmas, holidays, all that is now depleted, right? So you don't have that running through you. You kind of lose your degree of what are you hoping for right now? Because everyone's hoping for the holidays in September, October. All of a sudden that's done. Your bills are coming in from a credit card, and so you got to navigate those. I think it's a combination of everything, but I think the light has probably one of the biggest things to do with it, because you're dealing with about 2 hours less of sun during the day compared to the maximum amount you get during the summer, because it's just past the winter solstice, which is the shortest day of the year, about December 20th.
I think because of that, it's tempting for us to just kind of hunker down, be in our houses or inside as much as we can. We don't think we have those opportunities to get out and enjoy the sun or get natural sunlight, or we don't know about the alternatives. And that's one thing that we're going to talk about, other ways that you can get this light that is healthy and good for us.
Because absolutely, you mentioned, and we can see today and where we live, it's beautiful out. There's a lot of sun out, and you can get good natural sun exposure and light exposure just from the ambient sun outside today.
I mean, those opportunities I feel like are, depending on where you are. It's funny because here we're in Florida, the Sunshine State. Yesterday was beautiful. We went with our family, extended family, and went to a park, and we were outside for 3 hours just playing together, getting a lot of natural sunlight and outdoor exposure, outdoor time. But obviously, I was telling my boys today, if you live in Seattle or if you live up north, where it's darker and gloomier, longer, there's a lot of cloud cover or there's snow and all that. It is tougher and harder to motivate yourself and to actually receive that natural sunlight. So,
absolutely. And one other encouragement, with respect to what you said, hey, people really do just want to stay inside. There is some degree of that that's actually, that idea of hibernation is okay. So in the winter, you do have the component where a lot of things do slow down in your body and also in society typically. Let yourself have grace to do a little bit less during the winter, because your energy is overall lower. So my issue sometimes with people doing New Year's resolutions is they start a new significant, energy workout or high energy workout in January when their energy is probably near the lowest. And that's a time when, yes, exercise is great, as we speak about all the time here, but it may be a time just to do more low or moderate intensity exercise, nothing real high intensity, because your overall energy is a little bit lower and you're in a degree of almost recuperation and rest and hibernation. And that's why it's okay to have those times of the year where you dial things back a little bit and let yourself rest during this time whenever there's less sun and energy at your disposal.
So men have a good excuse to watch football, lay around and watch football more,
Didn't say that.
You heard it from the doctor.
Just a little bit.
All right, just a little
Everything
bit.
in moderation.
Exactly. So what we're going to talk about today is 7 steps to navigate Blue Monday and seasonal affective disorder. So we kind of went into a couple of these already, but we're going to start out with number 1, which is light exposure early and throughout the day, including red light therapy and light boxes. So obviously, if you are in a place like we are in Florida here, where you can get up early and the sun is shining and you got blue skies, get out there and just get some natural sunlight, even if it's 10 minutes, 15 minutes in the morning. Just expose yourself to the sun, get outside.
Absolutely. Yeah. And exactly. So if you've got a day that's like today, you've got the ability to go ahead and get your light exposure and your light activity. What you want typically is earliest in the morning, right after you're getting out of bed, to get as much light exposure to your eyes and to your retina as possible. What that does, it actually lowers the production of melatonin in the morning and suppresses your production throughout the day, but helps reset your circadian rhythm so that in 12 hours when the sun starts going down, your body will naturally produce more melatonin, and your body and mind will be a little bit more calm and able to get ready to go to sleep. Now, things that you can augment with respect to light exposure if you don't have good sun exposure, and even if you do, you can do this throughout the day or early morning, is a light box, which is like here we've got a light box from Brain MD, and you can see it provides light exposure or light to your room, ambient light. That we actually have this on our in our kitchen on one of our countertops, and we'll put this on first thing in the morning when we get up to make coffee and get something to drink water-wise. Try and get outside, but of course in the Panhandle we've had a number of gray, gloomy days where you don't have access to good light. So this just being available in your kitchen provides ambient light to your retina and just to the environment to allow you to wake up and stimulate you a little bit more. And there's good evidence that light therapy with boxes like this can actually help improve some of the symptoms of seasonal affective disorder. I then have this box right here, which is from Platinum LED. This is actually a red light therapy box, and what this does is it gives off red light at wavelengths that are in that 700 nanometers wavelength. When you think of blue light's in that 450 nanometer. This is in the 700 nanometer, and what red light does, it actually kind of does the opposite of blue light. Blue light actually will pretty much suppress your production of melatonin. So if you have blue light exposure from screens, TV, phone, things like that later in the evening, you actually are going to have less melatonin production later in that evening. But if you get blue light exposure earlier in the day, there's evidence that actually your melatonin production rebounds later in the day, as long as you don't get that blue light later. So a way to prevent you from getting as much blue light later in the day is to use blue blocker glasses in the afternoon and evening. So I've got two glasses that I'll wear usually in the afternoon or evening. I'm a radiologist as well, so when I'm reading x-rays, CAT scans, MRIs, I'll wear this lighter lens. It's by Gunnar, Gunnar. Helps block about 65 to 68% of the blue light coming in your eyes, but you can still function with respect to reading and interpreting things or what have you on the computer. This is actually a darker lens that actually blocks up to 98% of blue light at 450 nanometers. And so this would be for later in the evening if you're reading a book, or if you're just even walking around your house wearing these, you're not going to get that blue light, that ambient blue light from screens and what have you, that's going to suppress your production of melatonin. And people do find that they sleep better by wearing blue blockers later in the evening. So you have kind of the two things. You want to get white light and or blue light exposure or sunlight exposure, or potentially red light exposure, any light in the morning. But you want to suppress blue light later in the afternoon and evening to get more of a circadian kind of production of melatonin. So this is just how light can really affect your day-to-day activities. And obviously the most natural light is the sun. And if you're not able to get that, then you can utilize some of these other things.
It's interesting because I mean, I've heard a little bit about this prior to researching some of this and talking to you. But it's amazing that even with these alternatives, like they have that big of a health benefit for us. And specifically with these, you were talking about in the morning, you just kind of have it up in your kitchen. So you're not actually having to, we talked about this earlier, but you're not having to just sit there in front of it,
I don't. Some people do, from what I've heard and what they'll recommend. Different light boxes have different recommendations, but some people will, with 12 to 24 inches, they'll kind of have to where they're not looking right in the light, but they're allowing it just to kind of bathe their face and bathe their retina and just bathe just their body. There is now with red light therapy, there's some evidence that utilizing this on bare skin, so naked or bare skin, actually from about 8 to 10 inches away, will help stimulate mitochondrial production. Mitochondria is the cellular battery. So red light therapy is known to help stimulate mitochondrial function and therefore improve energy potentially in the cells and tissues. And so there's a lot of evidence with red light therapy, and this also ties into the laser therapy device we have, which ties into that whole component of photobiomodulation, and that cells have components of them that are stimulated by light, and that light helps with many different things, from circulation to inflammation to energy production. And so these are things that of course the red light therapy has some evidence to support.
Yeah, that's amazing. Just the benefits of light, and it shows you by design our bodies were intended to be exposed to light a lot more than we're exposing them to it, you know? So it should encourage us all to make an effort to get outside more and get the natural sunlight that you can get, or make the effort to spend a few minutes. And so for this one specifically, is 5 to 10 minutes good, or what do you think is a good?
Great point. So like for this, I would not have this. I have this in my bedroom. I don't have it on in the morning. It's actually it's very bright. And if you look at it, you can you'll see spots for a few months. I'm kidding. A few minutes.
Great.
But that's why you wear, these screens if you're in front of it, so that prevents the light from getting in straight to your eyes.
Can this one burn your skin at all, or like any kind of?
There's a potential that red light at too much intensity can potentially cause blistering. That's kind of hard to do. You'd have to expose yourself to a lot. So these are sessions I'll do 5 to 10 minutes to whole body, and just that does, again, that's that red light therapy that hits your entire body. There's some evidence that for wound healing and for recovery, red light therapy has shown some evidence of benefit.
Is this one going to touch inflammation? And
it probably will to a certain extent. I mean, not as intense as the laser will. But this certainly has some benefits overall for like systemic inflammation. But it's going to be probably minimal. I wouldn't call it like a cure. This is going to be like a holistic thing that just is a part of a multi-pronged approach to benefiting, your overall systemic health, especially during the winter and such.
Gotcha. All right. That was just number 1. Let's get moving. That was good. There's a lot there for sure. All right. So number 2. For the 7 steps to navigate Blue Monday and seasonal affective disorder would be 8 to 9 hours of sleep a night, getting to sleep earlier in the evening. So you know how important sleep is, but especially this time of year.
Absolutely. So if you think about it, the sun's going down at 5 o'clock in the Panhandle. So you want to get as much sun exposure as possible, which means getting up as early as possible to get that early first light. And then as the sun goes down at 5 to 6 o'clock, start dialing it down to aim to get to sleep around, depending on what your activities are. For us, it's around 8:30, 9 o'clock, and so we've got an early morning. So obviously getting to sleep as early as possible gets us closest to that 8 to 9 hours of sleep a night, which again, to go into all around, the year, I guess I'd recommend 8 to 9 hours, but particularly around this time to get that hibernation, regeneration, and again, that component of giving your body grace. You've been through 2 months of holidays and all of that. So now it's time to kind of recharge and settle down the energy.
So specific to navigating like depressive feelings, Blue Monday, being down and sad, this, seasonal affective, when you're not getting enough sleep, obviously you tend to be more sensitive and down and kind of low and gloomy and want to hit on that anymore, or kind of?
I just think like your body kind of expects a consistent degree and time and quantity of sleep, and if it doesn't get that, it's asking questions to your mind and saying, what are you doing here? I'm not dialed in. So that's where, and now there's some people, small number of people that don't need as much sleep. Those are few and far between. I would say majority of people need that 8 hours of sleep a night, which would require about 9 hours in the bedroom to dial everything down, calm down, and get to sleep. That's 8 to 9 hours in your bedroom.
Okay. So another good one. So now we're on number 3, which is reduce or eliminate alcohol.
Again. So here we are post holidays, which a lot of people probably drank more than they desired to during the holidays. It's okay. Give yourself grace. It's done. But now's the time to, again, continue or reset yourself to decrease the amount of alcohol you're exposed to and or dependent on, and you'll see typically energy will improve. We had a patient last week that I was talking to, and I'd forgotten to ask really detailed questions on the alcohol the previous visit, and because some things were going on energy-wise, I decided to peek into that a little bit more, and before you knew it, we counted about 16 to 20 drinks a week, which, you know, that's a good amount of alcohol, and for me, that would put me way down energy, you know, ability to perform at work and with the family, all those things.
Right.
So it's something that's very important to recognize that alcohol does have a depressive effect, no question.
So for your mood, depressive mood.
Absolutely. Yeah.
So make an effort to reduce or eliminate alcohol. It's another big one. Number 4, consider increasing complex carbohydrates.
So it goes counterintuitive to some of the things that maybe we've talked about or others have talked about, that reducing carbs lowers your risk of insulin resistance and diabetes and potentially helps you lose weight. But strict carbohydrate reduction and significant carbohydrate reduction actually lowers serotonin and can potentially precipitate depression. So you have a lot of people with New Year's resolutions going on restrictive diets. And let's say they're going from 150 to 200 grams of carbs a day during the holidays or pre-holidays, and then they go to 50 grams of carbs in January. Wow. Guess what? They're going to produce less serotonin and probably be a little bit more depressed because they're not getting enough carbohydrates. So it's a fine line and a balance with everything. I'm not against New Year's resolution diets to an extent, but I will recognize that if you're dealing with some depression, potentially increase your complex carbohydrates.
So give me some complex carbohydrates.
Sure. Complex carbohydrates, you think about sweet potatoes. You know, even white potatoes are a little bit more glycemic, but they certainly have a complex component to it as well. Peas, beans, rice, those are all considered complex type carbohydrates. Other vegetables can be complex carbohydrates, starchy or not. So obviously you can... Fruits can, a lot of them have some simple you know, sugar in them as well. But yeah, I'm thinking more like I would say vegetables and beans and legumes and stuff. It would be kind of those complex carbs. And again, many people tolerate them. Some people don't tolerate beans and legumes. So it depends on the person. But getting some more carbohydrates and even, dare I say, sugar can allow you to make a little bit more serotonin during times if you're dealing with depression. And I'd say also getting enough protein, but for those patients who are struggling a little bit more with anxiety, seems to be that protein allows a little bit more benefit on that range. So depression, sometimes getting more carbs. Anxiety, getting more protein. These are kind of the first things that I may push at patients if they're navigating those two extremes of mood disorders.
Gotcha, that's good. All right, so moving on to number 5. Low to moderate intensity exercise, some strength training and walking.
So again, going back to the exercise thing, we recommend exercise a lot, don't we?
Oh yeah, it's huge. This time of year too, like we just have this, unless you're making a New Year's resolution that motivates you to get out and do it, you tend to just want to chill and relax and lay low and not be active. And so yeah, this is something you have to be more mindful of during this season. You know.
Absolutely. You notice how I didn't put high intensity exercise. Now, I'm not saying don't do high intensity exercise during this time, but during January, February, as a lower energy type time and season, you may consider more low impact activities, more moderate intensity and not as high of an intensity, because you've got a little bit less energy, and there's a little bit less energy in the society, I guess, from the light and from everything going on, that you may want to do a little bit lower impact activities. So strength training, walking, potentially jogging, you know, certainly some higher intensity is okay, but you may dial things back a little bit because we're just getting past the holidays. And this is specific to patients who are dealing with depression and seasonal affective disorder. But getting some of that circulation and some of the good endorphins that take place with some exercise and strength training is the benefit right there.
I see too, specific to depression and anxiety, doing this with others, like in a group setting, community, like that really helps specific with the anxiety and the depression. Just being in a community, doing things and feeding off other people's energy and encouragement and So yeah, try to find groups or other people you can get out and do these things with, and there's a lot of benefit there too.
But one of the encouragements with this is, hey, with seasonal affective disorder or challenges in January, everyone's dealing with it.
Yeah,
so you're not
true.
alone.
Exactly.
I mean, we are.
Yeah.
I think everyone's dealing with a component of it that they have to navigate
Yeah.
in their own way. But we're just trying to find and offer you guys
Yeah.
steps to maybe empower you if you're struggling with it significantly this year.
It's funny because I was just thinking as you said that, it doesn't take the weather or the time of year to go through cycles in our lives where we're up and down. So you could be in the middle of the summer and feel sad going through, whatever. So just, everybody's kind of going through this stuff together. Know there's people out there that are there to encourage and lift you up and find those people. So but community and working out together, finding people to do these things and go through life with, very important. Number 6, I like this one. It seems so simple, but plan a trip or a vacation for the spring. It's so simple and basic, but I love how it gives you something, because like you said, we just got through Christmas, you kind of got through all the big events, the fun season, and you're just like, man, now I'm just back to work, back to the grind. What do I have to look forward to? It's great. Plan a trip for the spring. It gives you something, enjoyable, like to focus on and to think about and to look forward to, and it's just a fun, simple thing.
There's a verse in Lamentations that says, God's mercies are new every day. I think it's Lamentations 3. And so if you think about it, that degree of hope and hoping for the next day or the next season, it's okay. And so every single day, God's mercies are new. So be recognizing that, give yourself the ability to hope and to look for the future. And plan that trip for spring break, whether it's a 3-day getaway or a week getaway, or plan that May vacation, whenever, when the kids get out of school. This is a time to start hoping for that and recognize that the season will shift. Time will kind of heal this seasonal affective disorder as more light comes to us every day.
Especially too, looking forward to the spring. The spring is when warmth comes back, the sun's out more, and you're just like back to it. Back to the fun, more outdoor time and all that.
So we're ready for a big winter storm. I know coming through here tomorrow.
Crazy. It's gonna be freezing here, like in the teens on Wednesday, I think. Really cold. So basically, I'm gonna need all of spring break off. Okay, Ross?
Okay.
You guys,
sounds good.
Okay, you guys heard that. I'm off for spring break. I gotta plan a trip.
Okay.
Number 7, supplements such as vitamin D, omega-3 fish oil, methylated Bs, methylated folate, L-tryptophan.
5-HTP.
5-HTP,
So the bottom line is there are supplements that can be utilized during this time. Now, first and foremost, to check people's vitamin D3 level and see if they're low. Low vitamin D3 level is independently associated potentially with mood disorders and, seasonal affective disorder. So supplementing that with light, the sun helps provide the production of vitamin D3, and or oral supplementation. Those can, benefit your D3 amounts, which can potentially lower your risk of depression.
That's a very common one that people are low in, correct? I mean,
absolutely.
A very high percentage of our patients come in with low D3.
Absolutely. And you typically want to supplement with K2, which helps the absorption, helps prevent calcium from going places you don't want to go. But other things that can be beneficial, omega-3 fatty acids have some evidence of benefit. Methylated vitamin Bs and methylated folate activate the body and activate the energy production of the mitochondria. So that all can be tied into a little bit better positive energy in patients who are struggling with seasonal affective disorder. Of course, asking a physician who is aware of these things can certainly help kind of guide you. And then also tryptophan and 5-HTP. These are all components of the production of serotonin, which is the neurochemical that helps kind of lower your risk of depression. It's like an antidepressant chemical or neurochemical. And tryptophan and 5-HTP help produce serotonin. So supplementing with either L-tryptophan or 5-HTP potentially can be beneficial. It also helps with sleep. And again, everyone may have different effects with respect to how they respond to these. I always typically recommend patients to start as low a dose as possible. And with something like tryptophan or 5-HTP, usually you'll dose that at night to help with sleep as well as serotonin production. tryptophan's found in turkey. It's kind of
it's known for being helps you calm down and sleep. Like it makes you tired, right?
The Thanksgiving hormone chemical. Yeah, but
so,
it also helps on the backside.
Is it in? What else is it
depression.
In? Like food wise?
It's
turkey
in
is what
eggs.
You hear about.
It definitely is in eggs. It's in turkey. Gosh, I gotta be honest with you. Just thinking off the top of my head, I'm not sure other foods that it's in, but certainly it's a thing. There's so many. Obviously, this is where Google and YouTube come up great. It's where you can look up and see, hey, where am I getting my tryptophan-rich foods? That's component and consideration.
We live in a great area for the omega-3s. Fish. Obviously, we can get a lot of good local fish. I know salmon is a good quality fish to eat too. It's not local, but it's still a good one for your.
Yeah, it's definitely not local.
Yeah, I wish that'd be really cool.
That would be.
So there are 7 steps to navigate Blue Monday and seasonal affective disorder. A lot of good stuff in there. The light thing, we talked about light, and I think a big part of why people struggle with depression is that it's a loss of hope. You kind of lose hope. You're struggling with if it's relationships, paying bills. There's just a lot of things obviously that you could get you to a point where you're struggling, losing hope, you're upset, nervous, whatever, anxious, depressed. So light. The light is what really does help overcome the darkness. And so, as believers, we believe that Jesus, is the way, the truth, and the life, and that he is the light of the world. And seek him. If you're struggling, depressed, discouraged, cry out to Jesus. He's there. He can help you get through any stressful, depressive season. He's helped me personally get through a lot of them. And so again, you're not alone. Hopefully there's people you can find in your life around you that will be there to encourage and point you to the truth and shed some light,
Absolutely. No question. There's definitely a double entendre with respect to our title.
Yes.
Seek the light, during this time of darkness. And we know a lot is going on with the election in Iowa that's taking place, the Iowa caucus, obviously huge ramifications for that, for our national election in the United States. Today is also the celebration of Martin Luther King Jr. And so considering what he kind of shed the light on with respect to freedom out of bondage, was obviously an incredible message. So we appreciate those two things as well that are taking place, but definitely wanted to hit Blue Monday because we do recognize people are struggling right now with low energy, with depression, with these things, and these are ways to help potentially lower those problems. So
we'll list these right below.
We will. I'll put on the list below for sure with these, and definitely thank you guys always for listening. We appreciate you. And we hope you guys have a great rest of your day and great rest of your week.